Agents, hey, this is Luis Moreno with Think Medicare, Think ACA. I've got a big announcement. This is something that has been asked of me by lots of agents, and it's something that I do for agents that are directly contracted to me. I do it for them. I don't do it for any other agents, but I am going to be doing it for agents that join my community. All right. So if you want to find out what I'm going to be doing and how to be part of the community of ACA and Medicare agents, first thing I want you to do, like this video. Second thing, give me some comments down below. And third, make sure that you subscribe to this channel. It is super important that I grow it. Help me out here. Subscribe and share me with your fellow agents. All right, so what the heck am I talking about? What am I going to be doing for agents? First of all, what do I do for my agents? So here's what I do for my agents. Guys, number one, for my agents that I contract directly underneath me, what we do is we provide training, okay? Crucial. So many agents out there fail, okay? They fail because of lack of training. They have no idea what they're doing, how to do it efficiently. No freaking clue. And as a new agent, how would you? All right. There's a lot of organizations out there that are super, super good at marketing, and they get out there and they find you and they contract you. Then what normally happens is like, look, they get all these agents because they're really good at recruiting agents. And they're like, look, we got some few videos, go watch them. Good luck. Hey, don't bother us. Or they grab a bunch of you guys, throw you in a pool and see who drowns, and usually one will do it. That's how I did it. I was the only one of a whole bunch of agents that figured out how to do this right. All right, so with that, here is what I do for my agents that I'm going to be doing for people who join the community. So for my agents, every Wednesday, in fact, I'm even upping this one more. Guys, I've got a community of ACA and Medicare agents that we're putting together. 25 years in business is what I'm going to be sharing with you. Guys, come join us at the community, a community of ACA and Medicare agents, and we'll show you how to grow. Thinking of things I can do for you guys. On Tuesday, Wednesday, Thursdays, here's what I do. I provide agent support and training in this manner. So on Tuesdays, I will be posting a link out there for those agents that, of course, are already mine. They're already invited. But those that are part of the community on Tuesdays, what I'm going to be doing is I host agent growth. Okay. This is not training. This is growing your business, running it efficiently. I try to bring in carrier reps. I try to bring other industry professionals that are going to share their knowledge to make you better. I'll bring some tax pros, financial pros, some investment or business pros, carrier reps that want to share their knowledge of their product with you guys. It's all about growing your business. Okay. That's what I do on Tuesdays. On Wednesdays, I do ACA 101 training. Okay. It all depends on the speed, but I spend 1 hour, 8:30 a.m. Central. It is about an hour. But if I get through everything, it will last between 5 to 6 weeks, 1 hour a week. All right. I start off with how to get started, with all the things you need to do to make sure you're set up correctly. We talk about, in fact, you know what? I'm going to pull up the curriculum here. We're going to talk about what it is. We talk about the federal stage. We talk about the state-based exchanges. We talk about certifications, all the contracts you need to have, the softwares that you need to make sure that you're set up with. We talk about the money. I call it show me the money, baby. Okay, we talk about that. We talk about healthcare 101, just the basics of healthcare. So I spent a good amount of time on that one so that you understand what you're selling. Then we get into the compliance, the latest and greatest that we have to deal with when it comes to compliance. And then we talk about quoting. Hey, how to collect the data, what data to collect and what to quote. Then we talk about enrollments, how to enroll people. We talk about retention. Okay, it's huge. Does you no good to enroll them and then lose them. We talk about, I give you all of my strategies for post-enrollment. And then we talk about the ancillaries that you're going to be cross-selling to make more money and make sure that your insureds are protected. We talk about the alternatives to ACA. Okay. And then I finish off with marketing. All that I do for my agents right now, I'm going to do for those agents that join the community. That's on Wednesdays. Now, on Thursdays, I do Medicare 101. This video is being sponsored by Agent CRM. Agent CRM is a CRM that I use for my agency for every line of business: auto, home, life, commercial, Medicare, and ACA. It should be the CRM that you use too. Click up here to get some more information. Even more training on that one. Now, that one is 8 to 9 weeks, and that's because Medicare is a beast. So on that one, we talk about how to get started with Medicare, all the stuff that you have to do just to get contracted and certified and licensed. We talk about that. We go over the 15 mistakes. This is huge. 15 mistakes that Medicare beneficiaries make when it comes to Medicare. Then I hop into what is just Medicare 101. We talk about understanding the Medicare options that seniors have. I go heavily into the money maker. This is how we Medicare agents make money. We'll talk about that. We'll talk about option 1. We'll talk about option 2. Those are the only 2 options out there. We'll talk about how the prescription engine works. Okay. We'll spend some time on election periods. Okay. That's huge because it's great to have all this knowledge, but if you can't figure out which election to use, well, you're not going to sell very much. We're going to talk about Medicaid and the Medicaid savings programs and how the 2025 dual SNPs are working. We'll talk about the presentation that you have to make to your insured so that you're 100% compliant. And then we'll talk about all the different Medicare scenarios out there where you can help our seniors and just weigh, the different people, the different scenarios that are out there that you'll run up against. And then we'll talk about marketing. All right. So all that is done 8, 9, sometimes 10 weeks. It just depends on my presentation and it depends on the Q&A. So not only will I be doing that for those agents in the community, but check this out. So to join the community, now, guess it's not free, guys. Nothing is for free. Okay. I don't work for free. Okay. So, but it doesn't cost you an arm and a leg either. It's $50 a month. For those of you that have kids, that's a visit to Chick-fil-A. I'm thinking, and that's not even with me or my wife eating. That's just what our 3 kids eat, $50. Okay. All right. You can get into the $60, $70 quickly at Chick-fil-A. All right. But here's what we do normally for our people. But I made this announcement for the community. We give you the ability that if you have a quote and you want to send it to us so that we can help quote it for you, we will do that. Okay. I have a mastermind. Now, I was doing them monthly, but I have a lot of fun with those agents. I'm going to try to do it weekly. Okay. At the worst case, it'll be a month, but I have been doing them weekly because there's so much to talk about in this business. You want to know everything about ACA or Medicare? Click up here to get my ACA and Medicare smart books. Ivan, my tech guy, he's posting stuff out there on ACA ad templates that you can use to post on social media. Okay. I love AI. There's a lot of commotion with AI right now, but I use AI in my business. So we're going to talk about AI a lot. We do workshops with financial pros, tax pros, and business planning because, yes, we sell insurance, but we're also sole proprietors. We also are running a business. So not only do we have to sell insurance, but we also got to manage our business so that at some point we don't have to keep selling insurance. Okay. We talk, bottom line, we talk a lot about lead gen, everything we do to generate leads. I've got that carrier specific trainings. Yes, I'd like to bring carrier reps in to talk about their products. And then when it's compliance time at the end of the year, well, guess what? I'm going to help you guys with that because compliance and recertification kind of sucks. I'm going to spend a lot of time with you guys talking about that. And then any of the tech tools that I use out there, the CRM, the commission tracking softwares, anything that I can find that I can discount it because we're going to offer it to lots of agents, you're going to get access to that. And then, of course, cross-selling, which is huge for me. Cross-selling is what allows me to buy toys. And I'm not talking about a Lego set. I'm talking about big boy toys. So I will tell you, cross-selling is huge. So we'll do a lot of that. So what the heck are you waiting for? Okay. If you're out there and you or maybe you're not doing as well as you want to be doing, or maybe you're just like, man, I can't find any training. Guys, you have two options. You can contract underneath me and you get the access to it. Or if you're happy where you're at, okay, you don't want to move, but you want to come join our community because you're in an island all by yourself. Okay. Got nobody to talk to, nobody to bounce ideas off, nobody to run up a quote and see if you're doing it right or wrong. And then plus all the training, agent growth, ACA 101, Medicare 101. Okay. All that. If you want to get that, come join us at the community. The link is down below. Okay. When you click on that link, it's going to take you to the community. And all you've got to do here is, yes, I want to join the community. It's $50 a month and you'll purchase it. There's no contract, guys. Of course, we want to keep you in here because we're going to be doing stuff for you all year long, but we don't want to lose you. Okay. It's a small group right now. We're trying to grow it, but we don't want to lose you guys. So we're always going to try to put a lot of value in it so you can keep it. So you can come join. Yes, you can get out, but we don't want you to. We want you to be able to get your ROI back on this community because of all the knowledge that you're getting, which is allowing you to sell more. So consider it, guys. I would love to have you all. And if you want, the link is down below. Just scroll down. You're going to see description and you're going to see more. Click on the more. It'll open it up. It'll expand it. And you're going to see the link there to join the community. Again, if you want my training, guys, this is it. Okay. All right. This is Luis Moreno with Think Medicare, Think ACA. Don't forget, comment, like, and subscribe.